I, Dr. R.K. Srivastav, will tell you about the human metapneumovirus, that is the HMPV virus, which is causing infection in the human being, and especially this is spreading from China. The WHO is also giving warning about this virus. HMPV is a common respiratory virus causing cold-like infections, especially in winter, and primarily affects young children and older adults. You should know about this virus, which is having the flu-like illness. Human metapneumovirus has been in circulation globally, even in India. According to the Health Ministry, none of those infected have any travel history and all are recovering well. The virus occurrence in India is not new. It was first identified in 2001 and has been circulating in the world for many years. It dates back to the late 1950. So this is not a new virus as the coronavirus. This is in the circulation from the late 1950s. By the age of 10, the majority of the children develop immunity against this virus. HMPV belongs to the pneumoviridae family, of which the respiratory syncytial virus, RSV, measles and mumps are also members. HMPV can cause both upper and lower respiratory tract infections and is generally seen in winter and early spring. Children, the elderly, and those with the weakened immune systems are more susceptible to the infection and developing complications from it. The symptoms of HMPV can resemble those caused by a common cold. So this is just like a common cold. The symptoms are similar to the common cold. These include a cough, running or blocked nose, sore throat, fever, and wheezing. The estimated incubation period is 3 to 6 days. In most people, the illness goes away on its own within a few days with rest and supportive care at home. In a few people, complications such as bronchitis or pneumonia may arise, requiring medical care. HMPV could not be compared with the coronavirus. Coronavirus was completely new and people did not have any immunity against it. But most of the people, they are having the immunity against the HMPV, which is similar to the common cold. HMPV has been circulating in the world for many years. HMPV spreads through air by way of respiration. This can affect persons of all age groups. Indian Council for Medical Research (ICMR) indicated influenza-like illness or severe acute respiratory illness in HMPV. WHO said HMPV was not cause for panic. It is a known virus that causes respiratory infections, mostly mild, similar to that caused by a common cold. Take normal precautions when we have cold. What are the symptoms which are commonly present in the HMPV? The symptoms of HMPV vary depending on the individual's age, general health, and immune system. In the mild cases, typically present with a runny nose, sore throat, cough, and fever, resembling a common cold. Moderate symptoms may include persistent cough, wheezing, and fatigue. These are some of the symptoms of the human metapneumovirus. This is a runny or stuffy nose, cough, shortness of breath, sore throat, wheezing, fever, and rash, which is the common symptoms of a common cold. In severe cases, especially in infants, older adults, and those with chronic illness, HMPV can lead to complications such as bronchitis, bronchiolitis, or pneumonia. Severe acute respiratory illness requiring hospitalization and may require treatment. Complications. Sometimes HMPV causes complications. These might be serious and require you to be hospitalized. They include bronchiolitis, bronchitis, pneumonia, asthma or COPD, flare-ups, ear infection, and the most common is the otitis media. So these are the complications which can occur because of the HMPV. Transmission occurs primarily through respiratory droplets from infected individuals or contact with contaminated surfaces. To prevent the spread of HMPV, practicing good hand hygiene is essential, including frequent hand washing with soap and water. So hand washing is one of the procedures by which you can prevent this virus. Respiratory etiquette, such as covering the mouth and nose while sneezing or coughing and wearing a mask, can also limit the spread. Avoiding close contact with infected individuals and regularly disinfecting frequently touched surfaces are additional preventive measures. So these are some of the measures by which you can prevent the transmission of this infection. The first one is cleaning your hand regularly and wearing a mask. These are the important ones. What are the precautions? The first one is the wear mask, the second one wash hand, and the third one avoid crowds. And you have to consult doctor if there are severe symptoms. Treatment of the HMPV is supportive and depends on the severity of the infection. For mild cases, rest, adequate hydration, taking a lot of water, and over-the-counter medications to manage fever and nasal congestion are sufficient. Taking over-the-counter medications just like pain relievers such as the acetaminophen or ibuprofen to ease symptoms like fever, pain, and coughing. Decongestants and cough depressants to help your symptoms. Use an inhaler to help with breathing problems like wheezing or coughing. Use a corticosteroid nasal spray to ease pressure inside your nose. The virus is nothing to panic about. It is a known virus that causes respiratory infection, mostly mild. Take normal precautions when we have a cold, wear a mask, wash your hands, avoid crowds. Consult a doctor if symptoms are severe. In severe cases, particularly those involving pneumonia or bronchiolitis, oxygen therapy and hospitalization may be required. Thanks.